I'm honored to report that in the last 12 months, the ASA family has taken a look at itself and made a number of changes. The biggest one is, of course, the decision to change our name to Leading Age. And quite frankly, even though we were called ASA, we have always been Leading Age. Also challenged us last year to focus on inclusion. And let me assure you, the process that the ASA family employed for choosing this name, as you saw, has been one of inclusion. We interviewed members to help us articulate what you valued most in your association and what you wanted to convey in a new name. And with your help, we came up with something that reflects our mandate: to inspire, to serve, and to advocate. Now, as you know, ASA organizes its initiatives around our 5 big ideas: quality, transition, talent, technology, and finance. And I'm also excited to share that we've effected a number of changes around each of our big ideas. Under quality, we are the leading sponsor of Advancing Excellence in America's Nursing Home campaign. Now, this initiative has helped change the conversation between consumers, government, providers about quality for residents and staff. If you work in a nursing home and have not signed up for Advancing Excellence, ASA family, the time to do so is now, because it is reporting the most promising quality improvement information for nursing homes of any two that's out there. Under the big idea of transition, believe it or not, we got HUD and HHS into the same room to discuss how housing with services can help people of modest means receive the support they need in the place that they call home. We also helped launch the Long-Term Quality Alliance, a coalition focused on improving transitions between hospitals, long-term care settings, and the community. Under the big idea of talent, our Institute for the Future of Aging Services developed the excellent Nurse Lead online training program. Now, this program focuses on communication, conflict resolution, and coaching to help charge nurses to be stronger leaders and support our most crucial component of our talent force, direct care workers. Not to mention, we are graduating our 4th class of Leadership ASA Fellows. Now, many larger members, including states like California's Emerge, have replicated this effort. If your state hasn't gotten on board in replicating Leadership ASA, I would encourage you to do so. And I would like everyone who has served as a fellow, a coach, or mentor, or a site visit to please stand so we can recognize your contribution. Now, under the big idea of technology, our Center for Aging Services Technology, also known as CAS, has long at last gotten federal government focused on technology, how technology can transform aging. CAS is conducting vital research for the federal government on the benefits of aging services technology and how this technology can remove barriers. But in my mind, there is no stronger example of our effectiveness as an association than under the big idea of finance. For the passage of CLASS Act, the provisions in healthcare reform is a shining example of how the ASA's agenda is making America a better place to grow old. Quite simply, the CLASS Act provides the gift of choice. Now, I know that there are various perspectives about healthcare reform, but no matter your perspective, I hope there is no question, none whatsoever, that the CLASS Act embodies the vision that we strive for, which is to expand the world of possibilities for aging. The CLASS Act will empower consumers to decide and make their own choices. So 6 years ago, a group of ASA members conceived the concept of creating this national long-term care program that would be affordable and available to people, even if they had pre-existing conditions. Many of us around the table thought while it was admirable, it was yet an impossible goal. But ASA family, when the opportunity arose during the healthcare reform debate to make this vision a reality, all of you answered the call. You served as ambassadors for the Long-Term Care Solution Program. You emailed and called your members of Congress. You rallied your residents and clients. And believe me, it made a difference. Your advocacy efforts served to set the stage for the ASA staff on Capitol Hill. It gave them influence on how the legislation was written and ultimately approved. And together, brothers and sisters, we will fight to ensure that the program thrives for the people we serve both today and those we also serve tomorrow. So two of the best parts of being your chair are representing you in your association and visiting with you. Because of ASA's growing prominence, I was invited to speak at the American Association of Service Coordinators, the Congressional Black Caucus, and to twice visit the White House. I was also honored to attend the Gulf States, Tennessee, Kansas, and Oregon Association conferences. Now, while representing you is certainly an honor, what I have enjoyed most over the past year was visiting with members and meeting with frontline staff. In Tennessee, I had an eye-opening conversation with some direct care workers from McKendree Village. Now, despite their commitment to their work and their dedication to serving elders, they knew very little about ASA or our advocacy agenda. And they really want to get involved and be a part of the ASA family's effort, but they haven't been invited to the table of inclusion. We know it is all about inclusion. Now, when I accepted the role of chair, I asked each of you to devote 15 minutes a week to grassroots advocacy. 15 minutes a week, an hour a month, to contact your congressperson through our Contact Congress system, or perhaps invite an elected official to visit your organization, or educate your staff and residents about the issues and getting involved in our advocacy efforts. And I am happy to state that my organization, Christian Church Homes, has created an internal advocacy committee, which includes residents, service coordinators, administrators, operation managers, vice presidents, and yes, our president and CEO, and board members, inclusive. Let me ask you, how many of you make a habit of using ASA's Contact Congress system to send a message to your legislators? Raise your hand. All right, some. And how many of you take the time to engage your staff and residents in advocacy? Show of hands. All right. My ASA family, brothers and sisters, if we are sincere about expanding the world of possibilities, then we should not be satisfied until every hand in the room goes up to the answer to those questions. Because the number one value that members tell us they get from their membership is advocacy. But advocacy is much more than scanning updates in an email newsletter. Advocacy is more than Larry Minix or Susan Weiss going to Capitol Hill for meetings. Advocacy, my ASA family, is about inclusion of every member in every sector, and yes, on every issue. Advocacy is you and me making our voices heard. Now, the theme of this conference is Who Decides? So who decides tomorrow who will be in Congress? America does. And who decides the agenda for aging services? Leading Age does. And who decides whether our voice will be heard? The answer to that question is you do. Each and every member and employee associated with our association. And the bottom line is that we must, because next year in 2011, ASA celebrates its golden anniversary. And the first wave of the silver tsunami enters the golden years. However, we know that there are external forces at play that could tarnish what should be golden moments. So let me propose a simple four-step plan to help you move forward on this change. First, I'd like you to start out by sending your new or re-elected legislators a congratulatory letter. I'd like for you to visit their district office to introduce yourself and your organization. I'd like to invite you to invite the legislators to visit you. And finally, I'd like for you to join us in Washington to storm Capitol Hill during our Future of Aging Service Conference this April. It's my understanding that the cherry blossoms will be in full bloom. Those are just 4 easy steps to enhance strong relationships for effective advocacy. And my friends, we are honored to be part of an association that thinks big, that acts big, and that achieves big. We are Leading Age. It's a name we've earned through our dedication and determination, but it's a name we must continually work to live up to through our words and our deeds. We must be the distinct voice for not-for-profit values. We must continue to educate and inspire one another. We must develop innovative practices that meet individuals' unique needs and preferences. And we must advocate for the policies that continue to expand the world of possibilities for aging. Now, this is an election year, and there's been an awful lot of division and bipartisanship between Republicans, Democrats, Tea Parties. But let me leave you with this thought relative to the ASA family. Brothers and sisters, it doesn't matter if your state is red or blue. The reality is that each of us have preferences in things that we do. And I'm extremely thankful for our various ways of worship and belief, because each of us need to find a place where we can seek comfort and relief. And so while I acknowledge the variations in the shades of our skin, for us, the ASA family, the attributes that matters is that there's a loving, caring, senior servant heart that lies within. Thank you so much.